In today's video, we're talking about pain after cancer and what does it mean. Hi guys, I'm Marina Blackford. Welcome to my channel. I am a two-time breast cancer survivor, and my channel is here to pay forward all the tips for you on your cancer journey. So welcome. Make sure you subscribe so you don't miss a thing. I have 2 lives a month where I welcome you to come on and join this community where you can ask your questions and share your support for others on their cancer journey. You'll also get 1 tip video a month and 1 vlog a month where you can keep up with my life as a cancer survivor and what I'm doing to prevent cancer and what my screening and treatment moving forward looks like. All right guys, let's dive into the topic. What is pain after having cancer and cancer treatment? It is something that you will likely experience on some level. All of our pain threshold is different. Some of us, a dull ache could feel like a very big thing, and some of us have a high pain tolerance. So when you have pain after being diagnosed with cancer and going through treatment, what could it mean? Here are the things that I pay attention to from someone that had breast cancer twice. First thing you want to take note of is how long have you had the pain for? Is it been a week? Is it been 2 months? I mean, most of us would want to pay attention after 2 weeks. That is the general rule of thumb from me as a dental hygienist, that if something hasn't gone away after 2 weeks, we should start to really pay attention with what the next step is. The next thing you'll want to do is what might help with that pain. I recommend trying to ice, maybe some heat compress, and ibuprofen or Tylenol. Does that seem to help? Also, any stretching, does that seem to help? What can you do to see if it alleviates the pain? The next thing to notice is, where is the pain? Is it somewhere where the cancer used to be? Is it in a new area of your body? But that's very important. The location of where the pain is could be related to where you had cancer treatment. When I had breast cancer the second time, part of my treatment protocol was to get radiation. Radiation therapy is something that in the moment is not painful, but lingers, and the skin gets darker and uncomfortable, and over time, even years, the body in that area is changed. The nerve cells have been damaged. The skin does not have the same feeling as before. So sometimes you're noticing pain from your treatment that you received. Radiation aches are pretty normal if you've had radiation. Is your pain coming after chemo? I've also been there. Chemotherapy can cause neuropathy. Check out my videos on neuropathy here on my channel. I list things that can help and what to expect when you have neuropathy. Neuropathy is another one that can slowly get worse before it gets better and could take a while before it gets better. Neuropathy is that pain and tingling in the extremities, usually hands and feet from chemo. Have you been exercising more? This is something that I experience. It could be exercise. It could just be more activity like lifting. Did you have a home project you worked on all weekend? Were you gardening? You should be very careful with doing any chest press workouts after having chest surgery. I've also noticed this after having radiation on one side of my body, that after doing yoga, which is very good for you, I tend to have some aches on that side of my body. And it's directly related to more movement and stretching, which is good for you, but can trigger your body in a way that feels different. The most important thing is after 2 weeks of noticing this pain, seeing if there's anything that helps, it might be time to tell your medical team if you don't have an appointment already scheduled. If your next oncology appointment is more than 6 months out, you should be calling your cancer center and making an appointment to see if your nurse practitioner or your oncologist wants to see you. If you guys want some peace of mind, consider asking your cancer center if there is a scan that's needed or due in your schedule. I don't believe in overdoing scans that cause extra radiation to our body, like mammograms, but if there's something like an MRI they can do or something else that's recommended for your cancer, see if that's a good option for you. I've also received some testing that is fairly new within the last year from a company called Signatera. This video is not sponsored by them, but I had a subscriber mention it, and I've done it at my cancer center. It involves getting a blood draw. The company will send a phlebotomist to you, or you can request to have your labs done at your cancer center. And the blood is sent off to the lab where they can help screen for heightened amounts of cancer cells in the body. This is called a residual disease test, and it could help you have some peace of mind if you're having unexplained pain in your body. Talk to your doctors whether this is a good option for you. Reporting these pains are important because it doesn't mean it's cancer, but it could mean that there's something that needs to be addressed. I don't want you to live in fear. I want you to be able to do something about your pain. If you need help during your cancer journey, you can hire me as your personal cancer coach. Go to www.marinablackford.com. I'm here to speak to you if you need it. If you need more videos, please check out my channel where you can find chemo, radiation, and surgery tips. I also want to see you on my lives here, so please hop on, and thank you so much for watching this video. I look forward to seeing you in the next video. Bye, guys.